Hey everyone, today we are learning about deep vein thrombosis, abbreviated DVT. Before we can dive in, it's important to understand the meaning of a DVT. Thrombosis means blood clot. Deep vein thrombosis is basically a deep vein blood clot, with the most common location being in the leg. The signs and symptoms of a DVT. You have to understand how they relate to what's going on. So, a clot is basically just a big chunk of blood just sitting there. Because of that, there might be pain, swelling, redness, and warmth at the site. However, remember this. Sometimes a patient may not have any symptoms at all. This is why labs are so important. So, who's at risk? To know this, you have to know how a clot forms. When a patient is inactive, blood may move too slow. Slow movement of blood can cause it to clump. We call this clump a clot, and a clot in a deep vein is called a deep vein thrombosis. This gives us the answer to our question, who's at risk? Patients who are not moving are at risk. And which patients aren't moving as much? Patients in a hospital who are laying or sitting in a hospital bed all day. So our next question is, what can we do to keep these at-risk patients from getting a DVT? Well, since patients get a blood clot from their blood not moving, let's prevent that blood clot by getting their blood to move. To get the blood moving, there are several things we can do. By the way, these are called nursing interventions. These include leg exercises, getting the patient to walk around more frequently, putting compression stockings on the patient when in bed to increase that flow in their legs, and another intervention that we can also add to keep these clots from forming are giving the patient anticoagulant medications, aka anti-clotting medications. But a note of caution, all patients who are on anticoagulant medications are to be put on bleeding precautions as well. Some patient teaching to offer the patient is to never, ever touch or massage a place that is red, swollen, and or feels hot to the touch, because this can cause the clot to be released and travel elsewhere, like the lungs. And that's when we have a pulmonary embolism, aka a PE. More on that later. If you like this video and would like to see more, please subscribe to our channel. Thanks for watching!